Depression is the leading cause of disability worldwide, affecting millions of people each year. In the United States alone, nearly 10% of adults experience depression. Yet, despite its widespread impact, depression remains a misunderstood condition. Unlike more visible health issues, such as high cholesterol, depression is a mental illness, which makes it more difficult to recognize and understand. One common source of confusion is the difference between having depression and just feeling depressed. Almost everyone experiences moments of sadness, whether due to a bad grade, a job loss, an argument, or even a gloomy day. Sometimes there's no clear reason at all, and sadness seems to appear out of nowhere. However, these feelings usually pass when circumstances change. Clinical depression, on the other hand, is a medical disorder that doesn't simply fade away. It persists for at least 2 weeks and significantly affects one's ability to work, enjoy life, or maintain relationships. Depression presents itself in various ways, with several emotional, behavioral, and physical symptoms. These can include persistent low mood, loss of interest in activities once enjoyed, changes in appetite, feelings of worthlessness or excessive guilt, sleep disturbances, either sleeping too much or too little, poor concentration, restlessness or physical slowness, fatigue and low energy, recurrent thoughts of death or suicide. To meet the clinical criteria for depression, a person must experience at least 5 of these symptoms. Depression is not just a state of mind, it has physical manifestations within the brain. Research has shown that the condition can cause observable changes, such as smaller frontal lobes and hippocampal volumes. The precise causes of depression remain unclear. Scientists know that it arises from a complex interaction between genetics and environmental factors, but there is no current diagnostic tool that can predict who will develop depression or when. The symptoms are intangible and internal, making it difficult to identify someone who is struggling. In fact, it often takes the average person suffering from mental illness over 10 years before they seek help. The good news is that depression is treatable. A combination of medication and therapy is typically used to help manage the condition. Medications work by boosting brain chemicals, while therapy can provide strategies for managing symptoms and addressing underlying issues. In severe cases, electroconvulsive therapy (ECT), which involves controlled seizures in the brain, can be an effective treatment. In addition, newer treatments such as transcranial magnetic stimulation (TMS) are being explored and show promise in providing relief. If you know someone struggling with depression, it's important to offer support in a compassionate and non-judgmental way. Encourage them to seek help and be prepared to assist with practical steps, like finding a therapist or making a list of questions for their doctor. Depression can make even small tasks feel overwhelming, and your support can make a significant difference in encouraging them to take those first steps toward recovery. Depression is a medical condition, just like asthma or diabetes. It's not a sign of weakness or a personality flaw. People with depression cannot simply will themselves out of it, just as they couldn't wish away a physical injury. If you haven't experienced depression personally, avoid minimizing their experience by comparing it to times when you've felt sad. This can lead to feelings of guilt or shame, making the person feel even worse about their struggle. Instead, acknowledge the seriousness of their condition and encourage them to seek the help they need. Talking openly about mental health is crucial in reducing stigma. Studies show that simply asking someone about thoughts of suicide can reduce the risk of them taking their own life. By engaging in these difficult conversations, we help normalize the experience of mental illness and make it easier for others to ask for help. The more people seek treatment for depression, the more scientists can learn about the condition, leading to improved treatments. Understanding and addressing depression is key to better supporting those affected and finding effective solutions. Ultimately, supporting individuals with depression through understanding, compassion, and encouragement can make a significant difference. By seeking help, sharing experiences, and discussing the condition openly, we can work together to break the stigma and foster a healthier, more supportive environment for all.